2019, a novel coronavirus was detected. That was the start of the COVID-19 pandemic. The event sent ripples across the globe, ripples that we feel today. It was a challenge for everyone, and it was more intensely felt by our frontline healthcare workers and professionals. I'm Ryan Funk with you, Multicultural. Together We Can is a project where we sit down with these healthcare workers and professionals to hear about their stories through the COVID-19 pandemic. Hello, how are you doing today?
I'm doing fine.
Thank you. So we have Mr. Henry today. Why don't you tell us a little bit about just yourself and the work that you do?
Yeah, my name is Henry, and I'm a school psychologist. I work in the school system and working with a lot of the children who need support mentally. We do a lot of work around trying to program for them, getting them involved, participating, and most importantly, try to get their education as much as possible.
Of course, incredibly important to help our youth get that track on to the next part in life. So normally you're sitting down, you're having a conversation. We're in opposite seats usually in this situation. You're talking to the student, asking them questions. How did things change once COVID hit? What was that experience like?
Well, a lot changed. School is a public place. Unlike a hospital where you still have sort of these wards, we're asking people to interact right from the time they walk into the building to the time they leave the building. And so that impacted how school was actually conducted, but it also impacted the fact that a lot of them couldn't go. We shut down. And so they were isolated. There's a lot of kids who were just etching to meet people, to be with people. Children are social people, and they really wanted to engage. It was very difficult to have them engage with anyone. They were isolated at home. Contact through computer, yeah, the technology is wonderful, but it just doesn't cut it.
Well, exactly. Like interacting with my friends, I found one of the things for myself during the pandemic was not having those physical interactions like we're having right now. Just it took a toll on people, and for like students, for graduations and stuff like that. That's a big moment. That moment of going from adolescence to adulthood, and they didn't have that opportunity. So it was all virtual with them for you?
And it impacts them differently. So yeah, we had our graduates who were, wanting that day, that wonderful day where they can literally just walk across a stage, greet the administrators, receive that diploma, do that goofy thing that they normally do, and it marks that moment, and they couldn't. Right? There was no need to go find that fancy dress. There was no need to figure out what you were going to wear. There wasn't that worry about, who do I take for a date? And you take those things for granted, but they're all part of growing up, and they didn't have that opportunity. But it impacted our younger kids even almost more because they didn't get the opportunity to learn some of those social skills that you learn in school. You're out for 2.5 years where you're learning to be with others and socializing, and you get them and it's like, we don't know what to do. We're not sure, how do you play again? Like, we're not sure how to do that. So it really affected them differently on the different ends of the continuum.
What, for anyone, there's probably so many stories that we can share about our childhoods in school, like going out in wintertime on top of the hills and like fighting on there, like digging, building snowmen, like, yeah, the interactions that change, like what must that do to the development of a child?
And we're dealing with it now. We're having to recoup that. We're trying to figure out what do we do to help them through that process because they missed out naturally. And so when we're expecting a student in grade 5, for instance, to have certain skills, we're realizing, they're missing something. Well, yeah, they missed 2.5 years of schooling. And so are we really effectively working with someone who has that social skill of someone in grade 2, which is that capacity is quite different. So we're having to work through that. But even returning, we never went back to let's get together. We had these isolated little cubicles and this idea of sharing. What is that? Like some kids like, what? Share it? You can't, because everybody had their own. You couldn't share a pencil because you weren't quite sure.
Yeah.
Right? What does this mean, sharing? And so yeah, it was a huge impact for some of these kids to get back into something we just take for granted, how to socialize.
Yeah, like it's just something that you don't think about at all. It's just throughout every generation, it's just something that we did. You just interact with people, converse with them, play, share toys, and it was just gone in a moment. I guess when you're sitting, at least in whatever capacity you could have these conversations with students, what sort of things were they asking? What were sort of advice that you were giving them during this period of time?
Well, a lot of them just didn't know what to expect. This global pandemic was something we weren't experiencing. So there's a lot of questions from the anxieties that come with it. Will this return? Are we sure? Can we not? So there's a lot of that anxiety around just feeling comfortable again. So it's that reassurance. And so we spent a lot of time just reassuring, and some of the, the dialogues we'd have with them, and says, the system, the schools, we are trying our best to keep you guys safe. And we would make sure we never made comments like, you will be safe, because we just never understood what was happening. You can't guarantee it. And so it was kind of confusing. They wanted some of those guarantees. All children want to be safe. And yet we really couldn't turn around and say, you're going to be 100% safe, but we're going to do the best we can to protect you. And that's why we have these measures in place. This is why we have these procedures. This is what we're doing. And it was reassuring because they kind of understood, okay, we have something. We've got something that somebody is helping us through this process. Somebody thought through this at least. And so there was that comfort. But you can still sense with some, it's kind of like, I'm not sure. And it really impacted some of the kids who have most mental health issues, children with some depression, anxiety, pre-pandemic, and they worried even more. I mean, to think about it, I remember speaking to one of the students probably about 6 months before the pandemic, right? And his worry was, well, what if something happens? Like, the world is, of course they have this doom and gloom kind of thing. And unfortunately, before the pandemic, we had Trump. So it really added to a lot of those issues because they're watching. And it was hard then to turn around and say, don't worry about it, we're safe, we're okay. And then the pandemic hit. And I remember one student just walking in and he says, I told you it was coming. And I didn't know what to respond. It's kind of like, yeah, this was unexpected. I didn't know it was going to happen. But look, we're surviving. Look, we're getting through it. There's a lot of things in place. I know there's a lot of confusion, a lot of questions, but we're going to get through this. And that's really what they want, is that reassurance.
So on a professional level, what sort of conversations were you having with other psychologists and colleagues on how to approach these situations? What sort of conversations you should be having with students?
So the first was literally the approach. How do we connect with these people when everybody said we had to be in isolation? We were confronted with the need, but then we really couldn't have contact. And so that was our first conversation. How do we connect? Because we know the connection was the most important thing, is how do we connect as much as possible. So after we worked a few of those things out, from having specific guards in front of us with the masks to doing it virtual, and having that virtual conversation with them, once we kind of figured that out, then it was, what are we going to say to these guys, right? And again, it's that building of and just giving them that reassurance as much as possible that we're working together. Humanity is strong, and we can get through some of these things, and we can actually ask the questions. We'll respond to those questions as much as possible, and plan around your individual need. So we didn't want to make it a global, well, everybody's doing this because that response, but I'm this way. So well, let's specifically
that individual approach.
If that, what is your concern? What are some of your things you're going through? Let's work through some of those as much as possible. Now, I just need to say that some kids thrived with this. Those really anxious kids who didn't want to go to class in the first place
were like that.
Were actually doing much better because everything was virtual online. They goes, couldn't we do this all the time, type of thing, right? So it did sort of help.
They're like, I don't have to interact with people. Oh, thank goodness.
Right. And exactly. And then, of course, some kids didn't put their camera on because I don't think they really did up their hair that day, and it was okay as long as they were listening and responding. So it kind of allowed us to realize that there is some benefit from some of the technology that came out of it too. So sometimes you think, well, that was terrible, but what? Some good stuff did come out of it, and we are helping other kids through this virtual approach that we never really had access to before.
Well, it's a potential tool that we can utilize in the future. So you are there for the students, you're having conversations with them, you're helping reassure them and give them guidance. For yourself, what sort of toll did this whole pandemic take on you, both physically and mentally?
Well, mentally, it was just simply knowing the need and not being able to access, and knowing that was going to be a big issue. It was really difficult to also see the systems kind of take time to figure things out, right? There's times that we saw the need and it was immediate. It had to be something that we wanted to do tomorrow. But then your systems are kind of like, well, wait, let's kind of work through this process. What are we going to do? They were learning as this was coming along, and that part was a little bit frustrating because again, we're in the front line. We see the need immediately. We can't tell somebody who's extremely anxious and thoughts of probably harmfulness. Can you just wait a sec?
Yeah, no
and we got to figure out this whole piece. And they're like, no, we can't tell them. We can't ask them to wait for it. Because so it's that reaction to something. And again, this was unprecedented. We didn't know this was going to happen. I think we're probably better ready if it were to let's not happen again.
Yeah.
But I think we're going to be ready to
knock on wood, right?
Yeah. Whatever we do, we're just going to. We definitely do want to be quicker on the uptake when this happens, and again, hopefully it doesn't happen again. But we did learn a lot from it.
Mm-hmm. Have you heard any follow-up from students like that you connected with? Did they let you know, like, yes, this was a good approach? Oh, I would have preferred X, Y, that sort of thing?
Yeah, I think a lot of the kids were quite confused with information, and they weren't always given the information. This is kind of what we're going to do, and they wanted a little bit more transparency, especially with the older kids. Just give us a little bit more transparency and find out why you made that decision. Why did you make it now? Why did you wait? Those kinds of things. A little transparency was definitely something that the kids were asking for. I think the other pieces were in the return. Again, it didn't seem to be as well organized as I think some students thought it was going to be. It was like, well, we're going to come to class and the teacher's going to lecture just like he lectured before. But wait a minute, we haven't done an exam for 3 years. So how are we prepared for this, right? Mm-hmm. And so being a little bit more prepared to help them catch up a little bit better, I think would have been something that's what the kids are saying to us. Of course, our government says they put in a lot of money and did all that kind of stuff, but it didn't seem to be completely directed towards some of these kids. Some of the kids were having trouble maybe, but just so that general public could have used some of that extra support. And so are the teachers saying that a little bit more support would have been better. How to train for this, how do we do things differently? And there was attempts, but I don't think it was as efficient or as clear that there could have been, it could have been delivered better.
What sort of collaboration was there with parents in terms of helping them out, like giving them information, helping out their students, kind of giving guidance and stuff with that? What was that collaboration like?
Oh, I think you should probably interview a parent for that because my take and what they told us is that wasn't great. So a lot of parents were asked to do the homework for them or almost teach the class because the online was for a short period of time, but then parents were taking time off work to do this, and they I do remember some parents were very quickly, oh good, you guys are opening up, this is awesome. It's like, because we couldn't do this anymore. We really couldn't take this anymore. I think too some of the frustration and anxiety that the kids had because we couldn't really connect. They didn't know what to do with it, but they also saw the trouble that the kids were having themselves. Mm-hmm. So then where do we get that support? Because we see our child suffering, we see our child going through this. Who do we call? Yeah, we can give it a call, but then we're not necessarily allowed to do that interaction and contact, right? So it become a little difficult for parents to really do the psychology, the teaching, all those kinds of things that were expected from all the other services that we have.
What do you think some things that were done really well within the school system in interacting with the students? What are some shortfalls, and what do you think we can learn from this whole experience moving forward?
Yeah, I think that they tried their best. The system was trying to figure out what to do based on information. I think, like I said, I think we've learned a lot since then. But I think we do need to understand that we do need to connect with kids. And as much as these pandemics want to isolate us, but we really need to create forums, and it could be virtual at times, but there needs to be opportunity for kids to get together. We are social beings, and it is the school that really develops and helps develop those. And so we need to have those in place as much as possible. If a pandemic lasts 2 years, yeah, we might not be able to do anything, but as soon as we're out of that, let's focus in on those social pieces again. That's what helps with mental health. I know they want their math and their ELA and all that kind of stuff, and that's important to learn. But if we forget that we also have to do some programming specifically around socialization, you're going to see more mental health issues.
Yeah, well, how are they supposed to succeed when they're worried about things dealing with depression? That sort of
Exactly,
stuff.
exactly. And again, we do always need more mental health services out there. And I know the government's trying to do that, but it's just not adequate for the needs that are out there. We need to really up that as much as possible and provide that service for all ages too. So it's not just as they're older. We're looking at some younger kids too who really need that support.
Yeah.
The hardest thing is to see a 6-year-old with the level of anxiety that we're seeing sometimes in our school system. 6-year-olds shouldn't have that much anxiety.
No, they should be enjoying life, making friends, making some mistakes here and there, but...
And learning from them. That's the best part about that.
Exactly. Well, thank you so much, Henry, for taking this time to share with us about your experiences and what you saw during the COVID-19 pandemic. My name is Ryan Funk with Multicultural. This was Together We Can. Thank you for watching.